just want to just take a moment to acknowledge that there is a real fear, anxiety, and mistrust in communities of color around healthcare. And this is something that's real. This is not, something that is invented or crazy or made up. This is a real mistrust, and this mistrust is valid. We in the medical community have not been completely ethical over the last 2 centuries in medicine when it comes to the treatment of populations of color. There's a history of medical abuse to our bodies, dishonesty in the use of our medical information, intentional marginalization of our communities in the healthcare system, and also in our everyday lives and other systems, like the criminal justice system. So we know that there's health disparities, and we know that those health disparities are unavoidable. In some cases are avoidable. I'm sorry, unnecessary and unjust. But it's just important to acknowledge that. It's important to acknowledge that the experiences that our communities have had. People point to experiences, for example, with Henrietta Lacks, who was a young woman whose cervical cancer cells, were taken by doctors at Johns Hopkins University for experimentation, and those cells essentially were used to help develop the COVID-19 vaccine, but they were taken without her express consent or the consent of her family. We've all heard of the Tuskegee syphilis study, where men were intentionally denied treatment for syphilis despite that treatment being available. And we've also heard stories about, the robbing women in our community of reproductive freedoms through forced sterilizations, through barbaric surgeries of enslaved bodies without anesthesia. So this mistrust is valid, and we should ensure, especially as care providers, that we are validating that, because trust should really be earned, right? It should really be demonstrated through the actions, that our actions are indeed trustworthy. So I just like to, take a minute to say that it's very important that we earn the trust of our community.